The day at work, I was leaving out of OR 15. Started to feel a little bit lightheaded, and when it was time for me to speak and give report, the speech was completely garbled. There was absolutely no structure. It was rather scary. My chief CRNA at that time, he came and grabbed me, and we went straight emergently to the ER to find out what was going on. When I finally got an appointment with a neurologist, they did the physical assessment and couldn't find anything wrong. However, they went ahead and ordered an MRI. Sure enough, the neurologist finally called me, and he said, "Matt, we found it." Very traumatic injury actually happened. As I was pulling out of the neighborhood, I immediately lost control of the vehicle, and thank heavens upstairs, I only hit a tree. That was the final big red flag, and that was a bad moment. Sorry. From that point on, things actually got worse. These things were happening more and more regularly.
Interestingly enough, with the majority of my epilepsy patients, I actually have been introduced to them by the neurologist. The partnership between Carolina Neurosurgery and Spine Associates and the Atrium Health physicians has really been very beneficial to the community and to the epilepsy patient community in general, because we've had the opportunity to advance the epilepsy care in the Charlotte region, not only with respect to the diagnostic procedures that we have for our epilepsy patients, but also from a therapeutic standpoint. It was very easy to connect with Matt because Matt works in the healthcare field, and I believe I actually had worked with Matt.
Dr. Van Poppel's not only a great surgeon, but when he talked to me in the office, he didn't paint a picture that was beautiful. He spoke reality, statistics, and facts.
It was found that he actually was suffering from a type of epilepsy that could be cured often with a surgical procedure, and he had not really delved into that possibility. We resected the anterior portion of his temporal lobe on the left side, taking care to avoid the structures that were responsible for language and for speech.
When I finally woke up in the ICU, all I could do was smile. For the most part, everything had gone fantastic post-op day one. It's been 100% gone.
He continues to be seizure-free, and Matt is back to work and working in the healthcare field with patients like him and with many other patients that potentially are benefiting from him being back in the healthcare field.
Being a CRNA is the most amazing job I've ever had in my life. I love being a nurse anesthetist at Atrium Health, Cabarrus, because of the workforce that we have, the teamwork that we are exposed to, the abilities to work together, and the honor it is to come into work every day. And after being blessed by this surgery and the people that have helped me, to then come home and be a normal dad, a normal husband, it's life-changing.